I want to talk about something that is extremely important today, which is snoring, but more so sleep apnea. Not everybody that snores has sleep apnea, and obviously for you to know for sure if your snoring is sleep apnea, you would have to go in for a sleep study. But there's a little telltale, is that if your snoring is very rhythmic and you don't stop snoring and then suddenly gasp for air and start snoring again, or if it's like, you know, if it's more rhythmic and you don't wake up feeling tired, hungover, foggy, that's probably just a natural snore. And there are many causes for snoring. It's just the muscles in the back of your throat are flaccid, or you are overweight and there's weight over here and it constricts your airways, or you are congested in your nose and you snore, or you drank a lot and the muscles in your throat relax because of either alcohol or medication or drugs, and you snore. So not necessarily it's a sleep apnea problem, okay? Just to make that clear. But usually it's nice to investigate if you notice that you're snoring, or if your partner notices that you're snoring. Definitely go get it checked out, because sleep apnea is something that has horrible, horrible consequences for your health. So what are the causes for both for snoring? Our face format, this was so interesting when I started studying this. Our face format has changed so much from our ancestors. They had way wider jaws than we do nowadays. And this can be because of toxin exposure and just bad formation, not as much breastfeeding as before. I guess children would breastfeed until 1-2 years old before. And now because of bottle feeding and other practices, we have tighter jaws. And the way our jaw is formed influences how we breathe, right? The nasal cavity and all that. Also because our ancestors ate twigs and very crunchy and raw and fibrous foods. They had a lot more chewing movement going on, so our jaws used to be so much stronger than they are now with the processed foods that are so less textured, they're so soft, we barely even need to chew them. They already melt in our mouth, as so processed that they are. So that was very interesting that our jaw has changed so much, and this has influenced the way we breathe. We breathe more through our mouths than our ancestors did. Also flaccid muscles, like I said, and the flaccid muscles can be age-related, it can be drug-related, alcohol-related. It just makes the muscles in the back of your throat get flaccid. Also neck gain, and weight gain in the neck. There's a way for you to know if you have fat neck, and it is to measure around the circumference of your neck. And for women, it would be 17, for a man, above 17 inches would be considered a fat neck, and above 15 inches for ladies. And that would compress your throat muscles and hinder your breathing and make you snore. Acid reflux as well can kind of damage the breathing muscles in the back of your throat because of the acid that corrodes. And so that could be a cause for your snoring or your sleep apnea. Nasal congestion, if you can't breathe through your nose, you're breathing through your mouth, so you're likely snoring. And being a male, I don't know why, but being a male is a risk factor for snoring and also for sleep apnea. So what are the signs that you have sleep apnea? So now let's go into sleep apnea. Like I said, not everybody that snores has sleep apnea, but you should go get it checked. The telltales that you have sleep apnea are snoring. Not everybody, but most of people do. Gum recession. Your gums start to recede if you have sleep apnea. Fraction of your teeth, your fractures in your teeth because you tend to grind during the night. Okay, so what is sleep apnea? It is moments during the night, several moments during the night that you are not breathing. So you are gasping for air. You wake up gasping for air, and there are moments that you're not intaking air at all. And this causes a stress response, obviously, right? You have no oxygen, your body is in panic. So this causes a stress response. So the sleep is not deep enough. You grind your teeth because of the stress response. Because of your clenching and grinding, you can fracture the tooth. You have TMJ disorders because of this too. TMJ disorders cause headaches. So it's a snowballing. So that's why it's so important to talk about this and go find out if you have sleep apnea and treat it, So sore muscles when you wake up here, because you've been clenching so much, dry mouth, sticky tongue, a scallop tongue, so you stick your tongue off around here, you would have teeth marks. That is a big sign that you have apnea. You're always tired. Why? Because your cells are not getting oxygen multiple times during the night, and you're not getting restorative sleep either. It's because of the apnea. So you're always tired, you're fatigued, you wake up gasping for air, you have night sweats during, waking you up during the night, and you have frequent urination, you have headaches in the morning. All this is a telltale sign that you might have sleep apnea and want to go get it checked. What are the consequences of having sleep apnea? And really here I'm trying to scare you into getting this fixed. It is a stress signal to the body, right? Because you're lacking oxygen. And then you produce a lot of CO2. CO2, when diluted in the blood, it makes your blood acid, very acid. So the more acidic you get, you tell your brainstem, area of your brain right there, and it senses CO2. It's very sensitive to presence of CO2 in your blood, and it makes your heart rate go up for you to exhale more of that CO2. Right? It makes your heart rate and your respiratory rate go up so that you can eliminate that excess acid by breathing out CO2. So you can get palpitations throughout the day. Apnea also causes inflammation in your body. It is a stress signal, and all stress signals trigger inflammation in your body. Any kind of stress, toxin stress, lack of oxygen stress, which is the case here. It also causes hypertension. So what happens with sleep apnea and nose and mouth breathing in general? When we breathe through our nose, which is adequate, we produce nitric oxide. Nitric oxide is a vasodilator. It makes your blood vessels dilate, expand. And this keeps your blood pressure in check. If you do not produce nitrous oxide, your blood is passing through a much tighter vessel and your blood pressure goes up. When you breathe through your mouth, when either you're snoring or you have sleep apnea, you are not producing as much nitrous oxide as you need, so you tend to have high blood pressure. Insulin resistance. Because you're not sleeping well, you can even develop diabetes. And I've talked about how we work out on a circadian rhythm. Our hormones have a rhythm, and if you're not sleeping well, your insulin secretion is not adequate, and you can become insulin resistant, and then you develop diabetes if you don't treat it. Sexual dysfunction. This is because you are damaging your vessels. You are damaging your mitochondria, so you don't perform. You don't get enough blood flow to where you need to go get blood flow to. Fatigue and brain fog. Self-explanatory, right? You're not sleeping well and you're not getting oxygen to your cells. It kills your brain cells, okay? So you really need to get that breathing corrected during the night. You have 2 times the risk of developing a stroke, also a brain damage, because brain needs a lot of energy, and if you have low energy because you have low oxygen and low mitochondrial function, you can have brain damage. Weight gain, and this is a vicious cycle, because if you are overweight, you snore and you have more chances of having apnea, and the apnea doesn't let you lose weight because you are insulin resistant. So it's a vicious cycle. They say that losing about 10% of your body fat really, really helps with that. Cavities. So if you're breathing through your mouth, there are 2 things that happen. The pH in your mouth drops, so you become more acidic in your mouth, and this favors the development of cavities, because the more acidic you are in your mouth, the more you deplete, degrade, I can't find the word, you ruin your enamel. So the protection in your teeth is ruined by the acid. And this turns your teeth more susceptible for the bacteria. And also, when you're mouth breathing, you provoke dysbiosis in your mouth. Imbalance of bacteria in your mouth. We have a good should have a good balanced microbiota in your mouth. So balance of good guys and bad guys, just like we have it in our intestines, just like we should have it in our vagina, just like we should have it in our skin. We have bugs all over us, way more bugs in us than we have cells of our own body. So cavities, because of the demineralization provoked by the pH and the dysbiosis. Bad breath, halitosis. Also because of the change in the microbiome, because you're breathing through your mouth. We should be breathing through our noses. Mood disorders, why? Because of grinding, because of clenching, because of TMJ, because of lack of oxygen, because of the acidosis. All this can cause anxiety and mood disorders. So breathing through your mouth while you're growing up can be a big trigger for attention deficit disorders in children. So it's very important for you to go watch your children while they're sleeping and kind of put your hand over their mouth and see if they're breathing through their mouth. And there's a ton of stuff that you can do to prevent this. It will even change their jaw formation as they're developing their jaw if you let them breathe through their mouth. So certain cases are surgical, certain cases you just need to mouth tape, certain cases you need to use a snore guard. I don't know. There is a way to fix it. You just have to go find out what the root cause is, okay? So what is the treatment for sleep apnea? CPAP is one of them. So it's a positive pressure, something that is injecting air to keep your airways open so that you don't lack breathing during the night. But you can also try to lose 10% of your body weight and see if that will help to fix the mouth breathing. So this will not fix snap apnea, okay? This is just for you to fix your mouth breathing, to retrain your body to breathe through your nose. You can try mouth taping, and there is special tape. It's not micropore, it's not Band-Aid, it's not duct tape, it's something that's very, very soft that even if you go like this, it will pop out the tape. It's a very subtle tape that you put over your mouth, just like kind of here in the middle, just to kind of train you to breathe through your nose again, which is so, so, so important. When we breathe through our noses, we heat up the air, bacteria gets caught in the cilia, the little hairy thingies that we have in our nose. We produce the nitrous oxide. We were made to breathe through our noses. When we breathe through our mouth, we don't heat up the air. We don't eliminate the first pass of bacteria. We don't have cilia in our mouth. We cause dysbiosis. We don't produce as much nitric oxide. It's just a whole thing. So we have to breathe through our noses. And then there's jaw adjustments that you can do either with therapy, with orthodontic treatments. It just really depends on what's going on with your jaw. There's also snore guards that you can put that makes your jaw go like this so that your airways are open a little bit more. Obviously, avoiding drinking and taking sedatives before bed. If you're going to drink, try to drink 3 hours before bed. Elevating the head of your bed with like books or bricks, or even buying one of those beds that elevate the head of the bed can really help maintain those airways open and help you not snore as much. Not sleeping on your back, definitely, because this just makes your back throat muscles kind of compress. So sleeping on your sides would be ideal in case of snoring. Using a humidifier. They have seen that it helps some people because the air is not so dry, and so it will help you breathe through your nose. Do not drink 3 hours before bed. And you can also, if you're congested, you can help that by rubbing eucalyptus oil, always diffused, diluted in a carrier oil. So sesame oil, coconut oil, olive oil, dilute it first because the eucalyptus straight up will burn your skin. So these are all things. And obviously, go get professional help, do a sleep study, really investigate if you are having sleep apnea. But the signs are pretty clear. If you wake up feeling super hangover, can't think right, really take a long time for you to... There are many other things that cause that, but if you have all these factors combined, dry mouth, bad breath, your tongue has a coating on it, all this can be a telltale sign that you have sleep apnea, and so definitely go get that checked out and treated.